One of the biggest things I hear from women with lipedema is I feel inflamed all the time. And honestly, many of them do, not just in their legs, but in their entire body. They feel swollen, puffy, painful, exhausted. Their rings get tight, their legs feel heavy, their skin hurts, their joints hurt. Some women describe feeling like their body is constantly reacting to something. And what is frustrating is that many of these women are told everything looks normal. Meanwhile, they're sitting there telling you they do not feel normal. A lot of women with lipedema start blaming themselves because they cannot understand why their body feels this way. But what I try to explain to patients is that lipedema is not simply a fat problem. There's often a very significant inflammatory component to this disease, and inflammation can come from many different places. Hormones can be a trigger of inflammation. Gut dysfunction can trigger inflammation. Food sensitivities, histamine issues, MCAS patterns, chronic stress, poor sleep, trauma, immune dysfunction, nutritional deficiencies. Sometimes it's not just one thing either. Sometimes it's several things all happening at the same time, slowly overwhelming the body. And over time, women start noticing more swelling, more pain, more fatigue, brain fog worsening, mobility intolerance, fluid retention. I think one of the biggest mistakes medicine makes is trying to isolate everything into separate compartments. The body does not work that way. Hormones affect inflammation. Inflammation affects the lymphatic system. The immune system affects swelling. Gut health affects immune signaling. Stress affects cortisol, which affects inflammation. Everything is connected. And many women with lipedema are walking around in a chronically inflamed state for years before someone finally starts connecting the dots. By the time they get to me, many are exhausted, emotionally and physically, because they spent years being dismissed. And honestly, I see so many women carrying shame they should never have been carrying in the first place.